Many of the questions you're likely to face on your exam will involve patient safety or safety regulations that you're required to follow as a nurse. One of the most important duties of a nurse is ensuring the safety of the patients. So in almost every question about patient safety, the correct response is going to be the one that does the most to ensure patient safety. This is usually the most cautious or most conservative approach of the ones listed. The answer choices up here on the board, for instance, are from a question that reads, "You must safely inject 3 different but compatible drugs into your patient's IV tube. Each drug is supplied in its own single-dose vial. The CDC requires you to A. Use the same needle and syringe for all 3 drugs. B. Use the same needle but different syringes. C. Use the same syringe but different needles. Or D. Use a different needle and syringe for each drug." Now, of these answer choices, the most cautious conservative approach is D, using a different needle and syringe for each drug. And in this case, this is the correct answer. For the first 3 responses, since the 3 drugs are compatible, it's unlikely that any of these approaches would cause harm to the patient. But because this is a safety regulation, it is far more likely to err on the side of safety, regardless of any additional costs or inconvenience that this procedure might incur. So when you're looking at a question about patient safety or health, it is usually wise to choose the most cautious, most conservative response.